Good morning, everyone, and welcome to the webinar, Getting Ready for Medicaid and SNAP Changes. My name is Dana Casserly, and I'm with the Pennsylvania Health Law Project. And joining me today are your two presenters for the session. We have Louise Hayes from Community Legal Services, and we have Amy Lowenstein from the Pennsylvania Health Law Project. Today's webinar is the first in a series of webinars that we're hosting this spring on Medicaid and the public health emergency unwinding. At the end of the presentation today, we're going to share the upcoming scheduled trainings that we have for the next couple of months, and we'll put the registration links for those trainings in the slides, which will circulate after the session. I just want to go over a bit of housekeeping before we get started. If you have questions during the presentation, please type them into the Q&A box in the Zoom control panel. I'm going to stop a few times during the presentation today for questions, and we're going to get to as many as we can get to today while trying to be respectful of everyone's time for our hour and a half that we have together. If you experience any technical difficulties during the webinar, please try logging off and then logging back in. And if you still need help, please email event@phlp.org, and that's event@phlp.org. The presentation today will be recorded, and a copy of the recording and the slides will be sent around after the webinar. Closed captions are available for today's session. To see the closed captions, you have to click the three dots on your webinar control panel and then click Show Subtitles. If you are seeing the subtitles and you want to disable them, you can click the three dots again and then click Hide Subtitles. So with that, I will turn things over to Amy Lowenstein, who will get us started today. Go ahead, Amy.
Thanks, Dana. So as Dana said, I'm Amy Lowenstein. I'm an attorney and the policy director at the Pennsylvania Health Law Project. And today, as the kickoff to our series on unwinding Medicaid, we're actually going to tackle SNAP and some Medicaid changes. This is really, as far as Medicaid is concerned, an overview of what changes are coming and what to look for and how to prepare. And other webinars in this series will cover things in more detail, including eligibility. I will say that during the webinar, if you have questions about Medicaid eligibility, we're not going to be able to answer them. And I would encourage you to attend our Medicaid 101 webinar, the link to which is going to be in the materials you get. So we're going to have two parts to this presentation. The first is going to be about the end of extra SNAP emergency allotments. And that's going to be Louise, who's going to handle that. And then I'm going to take over and talk about Medicaid continuous coverage. We're going to talk a little bit about how we got to the point where Medicaid was being continued, what is changing, so what's unwinding, preparing people or yourself for renewals, and options for people if they are ineligible for Medicaid. So now I'm going to hand it over to Louise to talk to you about SNAP.
Great. Thanks, Amy. I'm Louise Hayes. I'm a supervising attorney at Community Legal Services of Philadelphia. CLS provides free legal help to low-income Philadelphians on a wide variety of issues, and also does systemic advocacy in DC and Harrisburg and Philadelphia to try to fix problems that are affecting people in poverty. Next slide, please. So I'm going to talk about the end of extra SNAP that people have been receiving since March of 2020. Just a quick overview of SNAP in Pennsylvania. But relatively recently, the income limit for SNAP was raised to 200% of poverty. So pretty much all low-income Pennsylvanians should be eligible for SNAP. If you are in legal services, our clients should be getting SNAP. And this is about 1 in 7 Pennsylvanians currently get SNAP. It's almost 2 million people in Pennsylvania. And the amount of SNAP that has been coming into Pennsylvania has been huge and was greatly increased during the pandemic. You'll see that it was 205 million a month in February 2020, and it's over $500 million a month that's been coming in most recently. Next slide, please. So the reason why the amount of SNAP that coming into Pennsylvania increased so much is during the pandemic, since March of 2020, everybody who qualified for any SNAP at all got the maximum benefit. So in the beginning half of the month, they got what you would think of as their normal SNAP benefit under sort of normal rules. But in the second half of the month, they got an emergency allotment or extra SNAP that brought their total payment for the month up to the maximum benefit. And we're going to see what that is in the next slide. And people who were already at the maximum got $95 a month in extra SNAP on top of the maximum. Next slide. So this is the maximums. For a single person, it's $281 a month. For a family of 4, it's $939 a month. It varies by household size. Next slide. So this extra SNAP, alas, has now ended. The last emergency allotments were issued last month in February. And because the extra SNAP has been coming in the second half of the month, this extra SNAP is ending right now. People are feeling it now when they might have been expecting the extra SNAP to come. Now is when it's not coming. So the rest of my few minutes here is to talk about what can we do to help folks who are losing that SNAP, and partly just to explain to them what has happened. So one thing is SNAP benefits don't expire. So to the extent that people might have saved some of that extra SNAP, they don't need to spend it right away. And we've been sort of saying this for the last couple of years, that you can accumulate that on the card just in case it could help cushion this blow now. Benefits stay on the card as long as the card is used at least once every 9 months. Next slide, please. So going forward, people are just going to be getting their normal SNAP, which may just be $23 a month, which is the a minimum benefit for households of 1 or 2 people. So how can we make sure that people are getting all the SNAP they can? So the way that SNAP is determined is there's that maximum benefit we just saw, and that the amount of SNAP you get is that minus 30% of your net income after deductions. So the county assistance office does a calculation that's not all that different from tax calculation. They will count your income and then give certain deductions to come up with a net income. And then they subtract 30% of that net income from the maximum to figure out how much of SNAP you get. So the key here to make sure you're maximizing your SNAP is to make sure that the county assistance office knows your income and knows all about your deductions to lower your net income and therefore increase your SNAP. Next slide. So how can you help somebody figure out whether they're getting the right SNAP? Well, for one thing, if they're already getting the maximum, they can't get any more. So there's some population, about 40% of households, I believe, are getting the maximum SNAP benefit. They're losing that 95, but we've got nothing for them. There's no way to get that 95 back. But for other people who are getting less than the maximum, we have a calculator on our website now. This is relatively new, where you all could check your own or the people you work with SNAP allotment and see what you think they should be getting. And if what the calculator comes up with is more than what the county assistance office is saying, then this would be a chance to check to make sure whether the income and deductions that the county assistance office is counting are accurate. So what is the county assistance office counting? You can, they send a notice when they say this is how much SNAP you're getting, and that might tell you. Or you can call the customer service center and they would answer. Next slide. So these are the deductions that matter. A lot of people say I've got all these expenses, and not all expenses count for SNAP purposes, which is often sort of sad to have to report to people. But these are the ones that will reduce your net income and therefore possibly increase your SNAP. So if you have high housing costs, and that would include your rent, your mortgage, taxes, homeowners insurance, those housing costs are deductions to the extent that they are high. So it's complicated math. And your housing costs include a standard utility allowance of $681 a month that almost everybody gets the credit for. If you have childcare or adult care expenses, those are deductions from your from your income. And childcare includes the cost of driving someone to care. So if you are taking the bus or driving someone to daycare, that can be counted as a part of your childcare expense. ELRC copays, if you're getting a subsidy, are childcare deductions. Cost of summer camp. If you pay child support that is court ordered, that's a deduction. And then for certain people, medical expenses, and that's the next slide. So for people who are 60 or over or getting a disability benefit, those folks can deduct medical expenses to the extent that they're more than $35 a month. And a lot of things can count as medical expenses. Health insurance premiums, like your Medicare Part B premium, but also if you're paying employer coverage, a deduction, medical copays, deductibles, bills, including back bills. Some people might have like a $5,000 bill that they haven't paid. Tell the county assistance office they can, if you're 60 or over getting a disability benefit, they can deduct that from your income and give you more SNAP. Transportation to the doctor or the pharmacy, glasses, dentures, hearing aids, medications, the cost of home health aids, and my favorite, if you have a trained service animal, your dog food and vet bills are medical expenses that can be deducted. Next slide. One other, this is sort of a really complicated area, but could really help a few people. There's a special program called PA-CAP. I think CAP stands for Common Application Program, something like that. This is for people who are on SSI or who get SSI plus Social Security as their only income. And the special program solves a problem, which is these SSI folks were under-enrolled and typically are under-enrolled in SNAP. And the solution to this problem was just to give them SNAP. So Pennsylvania's DHS and Social Security, their computers talk to each other once a month and identify single people who are only getting SSI or SSI plus Social Security and are not getting SNAP. And those people are just enrolled in SNAP. They're sent a card saying, here is SNAP, use it. And this is great. It's helping a lot of people who otherwise wouldn't get SNAP because they haven't applied. But the downside is they're not getting the same amount they would get if they applied the regular way. So there's a chart here. The most folks who are in this special program can get in SNAP is 156, which is a lot less than the 281 they might get, which is the maximum. We think these numbers are way lower than they should be because almost everybody who's on SSI should be getting more than this. And in other states that have programs like this, most people are getting that 281. So we're working on trying to get to the bottom of this. But in the meantime, if you're working with somebody who's on SSI and they're getting, their SNAP just went down because of the end of emergency allotments, and they're now just getting one of these figures, they may be in PA-CAP. and which is good because otherwise they wouldn't be getting SNAP at all. But they could be, it's probable that they could get more. And the way you get more is by submitting a regular SNAP application. We see a lot of people who end up in this category because they were getting SNAP and then they didn't submit a renewal form. And when they missed the renewal form, then the computer, their SNAP was cut off, and then the computers connect with Social Security and they say, ha, here's somebody who's on SSI and not getting SNAP, and they enroll them in CAP. And the person who missed the renewal form just notices the reduction in their benefit. They don't sort of realize what's happened was they were disenrolled from regular SNAP and enrolled in this new program. Next slide, and I think this is my last one. So what happens for folks who are getting the regular SNAP and there's no way of increasing it because they're getting the right amount and they still don't have enough to eat, which is going to be a lot of people. So a few ideas, none of these are great solutions. WIC for kids up to age 5, people are pregnant or postpartum. This provides a fixed array of foods that are nutritionally customized for people in these categories. For people who are over age 60, they can get a senior box once a month. And you're going to get these slides, so you'll have these links to the places where you can get this help. Findhelp.org will help people find food pantries near them. It's zip code based. And just a couple of advocacy things. The governor has proposed to increase the SNAP benefit, minimum benefit from $23 to $35 a month for people who are seniors or have disabilities. An extra $12 a month isn't going to make up for the loss of emergency allotments. And this would help about 100,000 people. Again, absolutely worth having. And we should be helping, talking to the legislature to make sure that this is adopted. The key advantage to that is it might persuade people who might otherwise not apply to apply, and they might end up being eligible for a lot more than $35 a month. And then the SNAP program is going to be reauthorized in Congress this year. And maybe you've heard that there's a lot of proponents of cutting SNAP significantly, adding work requirements. So talking to your Congress folks about making sure the Farm Bill protects and strengthens SNAP rather than cuts it this year. And I think the last slide just says questions. And I think now's the time to ask SNAP questions before we move on to Medicaid.
Great, thanks, Louise. We did get a few questions in the chat. I'm going to go through them for you, starting with the first one. What happens with when a person's income fluctuates week to week? So for example, 1 week scheduled for 14 hours, next week scheduled for 6 hours.
Yeah, those are hard cases. When people apply, the county assistant's office has to come up with their best judgment about the sort of the average amount it will be over the next coming months. And it's difficult for them, but they come up with a number, and that should remain the same for 6 months at a time unless your income goes over 130% of poverty or goes way down, and you can say it's gone down and please readjust my SNAP.
Great. Can a family member charge room and board, and that can be used as a deduction for an adult?
That's sort of probably a more complicated question than we can get into here. Maybe email me directly.
Okay, great. And Louise, your email was put into the chat, so folks can reach out to you for that question.
Yeah.
This is a clarification. Is this correct that the 2023 SNAP was reduced due to the COLA increase to SSI income per the Social Security letter? Is that right?
When there was the COLA in January, there were a tiny number of people who became ineligible, and yes, their SNAP was reduced a bit to, which did offset some of that COLA. It shouldn't have offset it by more than probably 30% of the COLA, but yes, it's tough every year, and it was particularly tough this year.
Okay. For medical expenses, what do we need to provide to the county assistance office and how many months of documentation need to be provided?
So they are going to want proof that you incur these expenses, and how many months. Generally, I think 1 month should be fine.
Okay. This may be more complicated. You let us know, Louise. How are benefits determined for non-married couples?
For SNAP, if you live together and purchase and prepare food together, then you have to be on this SNAP together. If you live together and are not married and you don't eat together, you can each apply separately.
Last question we have on SNAP in the Q&A is, does child support that is not court ordered count as a deduction?
No, alas, it's got to be court ordered.
Okay. All right, those are all the questions we had for SNAP. We will now move on to Amy's portion of the presentation, which will cover the Medicaid changes that are coming up. Thank you, Louise.
Thanks, Louise. Okay, so I'm going to talk about the end of Medicaid continuous coverage. But before I do that, I want to just give you a little bit of more information about the Pennsylvania Health Law Project. So PHLP is a statewide nonprofit legal organization. We are focused on helping people access quality public health coverage and services. That primarily means our work is focused on Medicaid. And what we do is we have a helpline for clients, and we also provide technical assistance to advocates, social workers, other providers. Our services are all free. We do community education and training. So if you're interested in the training, you can contact us for more information. We do a monthly email newsletter, and that has a goal of keeping people informed about any changes to Medicaid or health policy, and also news about what's going on in the world of Medicaid and other health insurance coverage. And finally, we do policy advocacy on all aspects of Medicaid, primarily at the state. And one area where we've been doing some work is about Medicaid unwinding. So that brings us to this presentation. So as I mentioned earlier, this presentation is going to cover generally what we should expect to see during the unwinding of Medicaid continuous coverage. If you have eligibility questions, I do have one slide with a link which will give you some of the income limits, but Medicaid eligibility is a little complicated too. There are deductions and there are, for different categories, count income different ways. So I urge people to attend our Medicaid Basics, Medicaid 101 training that will be coming up in the future. Before I get into Medicaid continuous coverage, I just want to level set and make sure we all know what we're talking about when we're talking about Medicaid. Medicaid is a means-tested program. It means it looks at income and, in some categories, resources for low-income people to provide health insurance coverage. And it is basically a federal-state partnership. So it's funded by both the federal government and, in Pennsylvania, the state of Pennsylvania. And the federal government, generally, in normal times, not COVID times, was covering 52% of Medicaid costs, and Pennsylvania would pick up the rest. So Medicaid continuous coverage is what we're going to talk about and how we got to the point where we have that coverage and where we're going. So normally, when people were on Medicaid before COVID-19, you would have to report changes that could change your eligibility, and you would renew it every year. And if you weren't eligible anymore, you could be terminated from Medicaid coverage. However, when the COVID-19 pandemic began, there were a couple things that happened that changed the way Medicaid was provided. The first thing is there was a public health emergency declared by the federal government. And this gave the states a lot of flexibility on how to run all kinds of their programs, including SNAP and other programs, but also Medicaid. Congress then, in March 2020, passed a law called the Family First Coronavirus Response Act, or FICRA for short. And this law is what gave us Medicaid continuous coverage. What it basically did is it provided an incentive in the form of increased money. So remember I said the federal government paid 52% of all Medicaid costs. It said, we will pay you, Pennsylvania, 6.2% more if you do certain things to help people who are on Medicaid. And one of those things was to maintain people on Medicaid during the public health emergency. And this was, we call this Medicaid continuous coverage, or MA, which stands for medical assistance continuous coverage. And what this meant in practice is that anybody who was on Medicaid on March 18th, 2020, when the law went into effect, or later, was able to keep that Medicaid, even if something about their eligibility normally would have been resulted in them being terminated. So, for example, and I like to give extreme examples, if somebody wins the lottery and suddenly has $1 million, they could, if they wanted to, continue to keep their Medicaid coverage. Also, if somebody just had a slight increase in income, they would be able to keep their coverage. And the goal of this was to, during the pandemic, especially early on, COVID was something we didn't have vaccines. We didn't know how it was, how quickly it was spreading. And it was to ensure that people had access to health insurance and quality health insurance that was affordable. So that has been the state of affairs since March 18th, 2020. Now, there were some exceptions, and I'm going to mention these and then take a little detour about continuous coverage. So under the law, if somebody voluntarily ended their Medicaid, like that person who maybe didn't need it anymore, they could end Medicaid. If somebody was no longer a Pennsylvania resident, they also would no longer get Medicaid from Pennsylvania. There was then a law that passed in November 20, a regulation that had no notice and comments period, so no public input, was passed in November 2020. And we call this an interim final rule. And what it did was it reinterpreted what it meant to have Medicaid continuous coverage. So Family First Coronavirus Response Act said people had to be kept on Medicaid and not have their Medicaid reduced. This new law came along and said, well, some people this new regulation, we're going to reduce or terminate. And there was no real basis for this. But some of the people who were impacted were immigrants who were in a category of Medicaid that they were allowed to be in, like they were pregnant or they were a child under 21. But then they aged out of that, or they were no longer pregnant. And there is a rule in Medicaid that if you're not pregnant or a child, you have to wait 5 years to get Medicaid if you're an immigrant. And so those people were terminated. There were other people who were on a Medicaid waiver who refused an assessment, who were, their annual assessment, they were terminated. There were a few other things. And then the largest population in Pennsylvania that was impacted were people who were on Medicare and Medicaid. We call those dual eligibles. Dual eligibles can be eligible for Medicaid, for full Medicaid, covering all of their costs, wrapping around Medicare to cover doctors' costs and hospital costs. But what was happening is this rule allowed states to take people off of full Medicaid and just pay the premium for their Medicare. So this was a huge reduction in their Medicaid benefits because suddenly it meant they went from having very affordable insurance to perhaps insurance they couldn't afford. And the last group who was not protected were immigrants who are not eligible for Medicaid that's funded by the federal government at all. So I want to take a little detour because there were some developments that are related to unwinding that happened in the last couple months. There was a lawsuit brought against the Department of Health and Human Services, that's the federal government, about that group of people on Medicare and Medicaid who were going from having full Medicaid to just having the state pay their Part B premium. And in January, a judge issued an order saying for all of people who were reduced, I'm just sort of paraphrasing the order, but basically said that all the people who were getting full Medicaid and then were reduced to just getting Part B, or who were in a category of Medicaid that wrapped around their Medicare coverage and now are being reduced to just getting Part B paid for, so that's significant loss, you all should not have been terminated. And the terminations should stop and people should be reinstated retroactively. So this is very recent, and it is happening as we're on the verge of no longer having this continuous coverage requirement. But I'm mentioning this because we're going to have more news on this. The state has issued a operations memo to the county assistance offices, telling them to stop terminating people or stop reducing Medicaid for these dual eligibles. And our understanding is the state is working on reinstating everybody who was terminated retroactively. So this is huge news, and it does impact the Medicaid unwinding because, as we'll discuss later, these are people who are going to be in a category of Medicaid that they normally would have been terminated from. In fact, they were. So it's going to affect what's going to happen to them in the coming year when they see their next renewal. So let's go back to the unwinding and talk about what happened during continuous coverage. So we saw a huge growth in Pennsylvania of people on Medicaid, and that's not surprising because people were not being terminated. The other thing that was happening is early on in the pandemic, a lot of people were losing jobs and may have lost their employer health insurance. So when that happened, they were looking for other insurance, and if they were eligible for Medicaid, were able to apply. And even if they then got a job that would have normally put them over the limit for Medicaid, they were able to keep that Medicaid. So in Pennsylvania, we've had a 29% increase. This is based on the most recent numbers in people on Medicaid, which means that more than 1 in 4 people in Pennsylvania are on Medicaid. Now, we've talked about the people who were on Medicaid, even though they would normally have been terminated. And the state, and now I, have started calling these people COVID maintained. It's just a shorthand for talking about people who got to keep their Medicaid, even though they weren't eligible. And in Pennsylvania, that's about 1.1 million people. And they can be divided into 2 groups of people generally. One are people who are flagged as, the state calls them COVID flagged, but these are people who have provided information, or the state has information indicating they're not eligible for Medicaid anymore. Or at some point since March 18th, 2020, they were no longer eligible for Medicaid. But they were kept on anyway because of the requirement to keep them on. The second group, which is about the same size, a little smaller, are people who did not renew. So as I mentioned earlier, Medicaid requires, for the most part, annual renewals of your Medicaid, where you provide information and the state reevaluates whether you're still eligible. Now, Pennsylvania still sent renewal packets out during the public health emergency, but if you didn't send your packet back in, they weren't going to terminate you. So there were a lot of people, about more than 500,000, who did not return their packets, their renewal packets, or tried to and something went wrong, but they were kept on Medicaid anyway because of this requirement that they continue to receive coverage. So that's a lot of people who were on Medicaid and continuing to receive it. So what happens, we all knew it wasn't going to go on forever. And originally the law, the Family First Coronavirus Response Act, said that the states have to keep people on Medicaid until the public health emergency ends. And the public health emergency kept getting extended and extended. And what happened was, in December, Congress passed the Consolidated Appropriations Act, which made a decision that instead of waiting for the public health emergency to end, a set date would be determined where the states no longer had to keep people on Medicaid if they were ineligible or didn't meet requirements like renewals. And the date they chose was April 1st, 2023. So essentially, the law decoupled the requirement to keep people on Medicaid from the public health emergency. Now, the public health emergency actually is expected, will be ending on May 11th, 2023. So this wasn't far off. We're about a month early, really 2 months early. So what this means is beginning on April 1st, the Department of Human Services, which is the agency in Pennsylvania that oversees Medicaid, can terminate people who are no longer eligible. But there are certain conditions that have to be met. It's not that on April 1st, 1.1 million people are suddenly going to lose their Medicaid. There are a lot of requirements and parameters, and a lot of planning has been put into trying to make this process go as smoothly as possible. So a few of the requirements that the states have to meet are making sure that the state is trying to get updated addresses for people so that renewal packets aren't sent to addresses from 2021 when the person moved during the pandemic, and requirements to try to contact people if mail is returned. And as an incentive to keep people, for the states to go about this process in a methodical way, the federal government is going to continue to pay some amount of increased funding to the state. It's not going to be 6.2%, but it's not going to, but they're going to slowly pull back the amount of money that they're going to pay to the state to help keep people on while they're unwinding this Medicaid continuous coverage. There are also a number of reporting requirements that have been put on the states, and we've heard from Pennsylvania that they intend to be public with their reporting and reporting data on how things are going with unwinding, which we greatly appreciate. That kind of transparency is important because there's a lot that's going to go on here. So let's start to talk about what unwinding is going to look like in Pennsylvania. And we will take some time to answer questions. I'm going to say I don't have all the answers. In fact, I'm sure there are questions people are going to ask that I'm going to say I haven't thought about that, and we're going to go back and we're probably going to ask the Department of Human Services. But in Pennsylvania, the state has decided to take 12 months, so a full year, to review eligibility for everyone on Medicaid, on medical assistance. So that averages out to about 305,000 people a month. That is a large number of people. And it's going to be a lot of work for people who are working at the county assistance office to get through all of the documents that are going to be sent in. It's going to be a lot of work for the customer services centers who are going to get phone calls from people with questions. And it's going to be a lot of work for those of you who help people with renewals and for advocates who help people with appeals, because there are going to be undoubtedly a lot of people who are terminated. So the most important thing to know right now, though, is people who are COVID maintained. That's the people who would have been terminated if it weren't before the law that required them to be kept on Medicaid, they have to have a full renewal before they're terminated for being ineligible. And this is true even if something about their situation changes. So what we're expecting is just, there will be hundreds of thousands of people terminated from Medicaid. And you can think about folks who are terminated in two groups, and we have different concerns about each group. The first group is people who are terminated for being substantively ineligible. What I mean by that is they sent in their renewal packet, the county assistance office looked at their information and has determined they're just no longer eligible for Medicaid in any of the categories of Medicaid that are available. Maybe their income is too high, maybe their resources are too high if they're only eligible for a category with resources. There are a number of reasons they could be terminated. And the latest estimate we have from Pennsylvania is that's going to be about 466,000 people. So for this population, and we'll talk about this a little later, the concern is, making sure those ineligibility determinations are correct, right? That they were considered for every category, but also connecting people with other health insurance options so that people don't have to go without coverage, even if Medicaid is not going to be the coverage they have. The second group is of people who are going to be terminated, or people who are terminated, but who are still actually eligible. So there is always a group of people in Medicaid who, for one reason or another, are not able to successfully renew their Medicaid. It could be that they didn't send in the paper, maybe they didn't get the renewal packet in the mail, maybe they handed it in late, maybe they sent in the documentation to the state, but it didn't get processed and a caseworker didn't see it. And so these are people who are terminated because something went wrong in the renewal process. So there was no determination that their income is too high or their resources are too high, but rather that they're just no longer eligible because the renewal didn't get completed or didn't get completed properly. These people often then, when they learn they've lost Medicaid, will reapply. And that whole process of being terminated and then reapplying and being found eligible is what we call churn. And we are very concerned at the Pennsylvania Health Law Project about churn. It does account for a large number of terminations. We know that the US Department of Health and Human Services estimates churn to occur in about 8%, at a rate of about 8% of the population that's being renewed, which is very large. We have some data from 1 month in 2019 that suggests in Pennsylvania, we could be looking at much higher rate of churn. Now, the state is taking steps to look at churn that we hope will help. There's a lot more communication that's being done about the importance of renewal than there was back in 2019. But at this point, we really have no way of knowing how many people will lose eligibility because something went wrong in the renewal process. And for that population, we are concerned about the fact that they're going to be disconnected to a health insurance they should be getting. And so we want as few people as possible to be impacted. And if they are terminated, getting them back on Medicaid as soon as possible with minimal to no disruption in coverage. So let's talk about when renewals will occur. So as I mentioned, April 1st is the first day that under the new law that people could be terminated from Medicaid, but people are not going to be terminated on April 1st in Pennsylvania. The first renewals were sent out and are being sent out this month in March with April due dates. And once the county assistance offices have the documents, they're going to have to review them and make an eligibility determination. So in conversations we've had with the state, they have indicated that most people won't actually see their Medicaid reduced if they're determined ineligible until May. Now, there might be a few exceptions, but for the most part, we're probably not going to see denials happening until May. And most people's renewals will happen when they normally were scheduled. So as I said earlier, Pennsylvania continued to renew people during the public health emergency. And let's say you didn't do your renewal in 2021, they would just send another one in 2022. They're going to use that same month that they used in the past years to schedule your new renewal. So that's most people, which makes it predictable for a lot of people. But there are two exceptions. So you might see people shifted a little bit. The first thing the state is going to do is align Medicaid, medical assistance renewals, with SNAP renewals. This is actually what normally happens. So normally the Department of Human Services has those renewals happen simultaneously. But some of these renewals became misaligned. So the Medicaid and the SNAP renewals are no longer aligned, and the state is going to take this opportunity to realign them. But they're only doing this for people who are in that COVID maintained groups, people who would have been terminated from Medicaid for not doing a renewal or because they were ineligible. They can't do it to people who have been renewing all along. Their renewal dates are not allowed to change. The second group is people who are on emergency medical assistance. Emergency medical assistance, or EMA, is a category of Medicaid for people who are immigrants who are not eligible for either regular state-funded Medicaid or federally funded Medicaid because of their immigration status. So emergency Medicaid doesn't really provide full Medicaid. It provides Medicaid for somebody's emergency medical condition. Let's say somebody has cancer, needs cancer treatment. So during the public health emergency, people who were on emergency medical assistance were able to stay on instead of having to renew and recertify that they still had an emergency medical condition. And the state's going to do a couple things with these folks. Remember I said earlier that there are people who are barred from getting full Medicaid for 5 years, even though they're qualified immigrants. Well, some of those folks get their insurance through emergency medical assistance because they have an emergency medical condition. The state is trying to identify people whose 5-year bar to Medicaid is going to end during the unwinding, and they're going to move their renewals till after that 5-year bar is over so that when they're renewed, they can be put on full federally funded Medicaid with all that comes with that. The other thing that's going to happen is the rest of the folks who are on emergency medical assistance are going to have their renewals distributed evenly over 12 months. And part of the reason for this is they don't just get a review of their income and resource eligibility for Medicaid. The state is actually looking at their emergency medical condition, which means there need to be people at the state who are reviewing medical documentation, which can be a lot. So to spread out the work, it's the folks who are in this category are going to be renewed over 12 months so it's evenly distributed. And the emergency medical condition will be reviewed at the same time as the financial review. Pause for a second, Dana, for questions.
Sure. Yep, we have a few questions in the Q&A panel. The first is, what does reinstated retroactively mean? And if somebody was told that they should have been approved by MA during the pandemic, but they were not, and they paid several months for penny coverage, is there a way to get a reimbursement for premiums paid?
Okay. I can answer the retroactive reinstatement question. And I think that relates to the discussion I was having about people who are on Medicare and Medicaid, whose Medicaid was reduced to just having their Part B paid. So if I was on Medicare and Medicaid and in January 2021, the state came along and said, you know what, your income's too high for Medicaid. We're just going to pay your Part B premium. That's the end of your Medicaid. Retroactive reinstatement would mean that the state should put me back on Medicaid and do it back to January 2021 when I lost it. The second question is actually different. So first of all, people who are affected by that court order I mentioned are only going to be people on Medicare and Medicaid. So it doesn't affect other people who had a loss of Medicaid coverage, or people who applied for Medicaid and were denied. So I can't, the question about Penny and getting reimbursed for premiums would depend somewhat on whether or not the Medicaid was put in retroactively. And that is not a question that I can answer during this presentation. It's sort of beyond the scope.
Thank you, Amy. Can a recipient find out if they are a COVID maintain?
Clear how to do that. So I will say this, that most people in Pennsylvania get their Medicaid through a managed care organization. And the managed care organizations have that information. So they're supposed to know who's been COVID maintained. So it's possible that they would share it, but I'm not sure who really knows that and whether that can filter down. You could ask the county assistance office, when your next renewal is due, and I think that would be helpful, but it's not clear how people find out if they are COVID maintained.
The next question is, I've seen a few cases with renewals in January or February where county assistance offices are terminating MA in March. Because it is not yet April 1 in these cases, have the county assistance offices been directed to continue PHE protected MA until the 2024 renewal because of the unwinding process?
Well, first of all, if people are being terminated in January and February, unless they meet some kind of exception to continuous coverage, those terminations should not have happened. And, I would talk to somebody at the county assistance office, or you can reach out to me. My email is going to be, I can't remember if it was at the beginning of the slides or the end of the slides, but that should not have happened. So so really they should be put back on Medicaid, and then their next renewal would be in 2024 if things go as planned.
Okay.
But obviously, if people are being terminated before March and they shouldn't be, that means some things are not going as planned.
Okay. Another question, a similar question. If my Medicaid was renewed in January, my income no longer makes me eligible. Will I have coverage terminated on April 1st, or will I be terminated in January 2024 during my next renewal date?
Our understanding is that, and I'm going to give some examples of this in a little bit. Our understanding is that if the person was maintained on Medicaid, even though they were ineligible in January 2023, that they will have that Medicaid until their next full renewal, which would be January 2024. That said, if somebody is in a category that might get shifted, that could affect when the renewal happens. Take one more now, Dana, and then I'll move on.
Okay, one more for now. Is there a way to tell when you're verifying eligibility on promise that a person will be losing coverage in the future? I've heard that it can show 2 weeks prior, but have not actually seen.
That's a question that I am not able to answer. I think it might depend on what your access to promise is. So I'm sorry, I can't answer that question.
We'll come back to questions at the next section that you want to pause at, Amy. Just let me know.
Fine. Okay, so there are going to be a number of communications regarding Medicaid renewals, and this is important, especially for people who were concerned and might lose Medicaid even though they're still eligible because they missed the renewal somehow or miss a communication regarding renewal. So at 90 and 60 days before the Medicaid renewal is due, the state is going to send out emails, texts, a letter. There's going to be a recorded phone call, letting people know first at 90 days, hey, update your information because we're getting ready to send your packet out. Make sure your address is up to date. Then at 60 days before the renewal's due, alerting people that the renewal is coming and letting people know that they can actually renew at that point. You don't have to have your renewal in hand to do the renewal. So 60 days before it's due, you could actually go into Compass, for example, and do the renewal. Then the renewal will be sent 30 days before it's due. And once it's evaluated, the county assistance office will send out its determination. If somebody is terminated, 30 days after the termination, they'll get a notice explaining to within 30 days, really, explaining that they can get what's called reconsideration. And we are going to have a presentation in our series about reconsideration and appeals. Reconsideration basically is a 90-day period after a termination where a person can show the county assistance office that they are still eligible. Maybe they provide missing documentation or show that they are eligible for a category the county assistance office forgot to look at. But it's a 90-day period, and then a person does not have to reapply for Medicaid if they do a reconsideration within 90 days. There's also going to be a mailing from Penny, which is the state-based marketplace for health insurance, telling people who've been terminated about the availability of Penny. And there's going to be a link in the slides you get with a list of these communications so you can get an idea what they look like. So I'm going to go through a few questions that have that we get a fair amount, and it's going to be a little random. But one question we get is, when can the Department of Human Services act on changes in circumstances? So remember, I said that people who are COVID maintained will keep their Medicaid till their next scheduled renewal. That's not necessarily true of people who are not COVID maintained. So first of all, I just want to remind folks about the timing of change reporting. So if someone experiences a change, like an income, resources, household members, any change, especially that affect Medicaid eligibility or could affect it, have to be reported to the county assistance office by the 10th day of the month after the change. So going back to my lottery winner, if I win the lottery in May, I need to report that to the county assistance office by June 10th. People in a nursing facility or on a waiver have to actually report changes sooner. That's within 10 calendar days. So during the public health emergency, there was no change in this duty. You still had to report changes, but if you didn't, nothing was going to happen. There was not going to be a change, there wasn't going to be a termination if somebody found out that you didn't report a change. So during the unwinding, there's going to be different responses to changes in circumstances that affect eligibility, depending on whether someone's COVID maintained or not. If they're COVID maintained, there's not going to be action, our understanding is, until this next scheduled full renewal. If the person is not COVID maintained, the CAO can look at the eligibility, and if the change makes the person no longer eligible, they will get a termination notice with appeal rights. So I'm going to give two examples. This is Rory. Rory's been on Medicare and has been on Medicaid since December 2019. I mentioned the Medicare because people on Medicare who are on Medicaid have to meet certain resource requirements. During the public health emergency, Rory remembers seeing some renewal forms from the Department of Human Services, but never returned any of them. In July 2023, so this is during the unwinding, Rory receives an $11,000 inheritance that is reported to the CAO. The county assistance office doesn't act on the change because Rory is COVID maintained, because Rory hadn't been doing renewals. Rory's Medicaid eligibility is reviewed at their regularly scheduled renewal in December, and if Rory's resources make them ineligible for any Medicaid category, they'll be terminated, but not until they have their renewal. In contrast, we have Marta, who is not COVID maintained. Marta's been on Medicaid since September 2018. Every September, she fills out and returns her paperwork. She last renewed September 2022 when her income from a part-time job was below the Medicaid level for adults. In June 2023, during unwinding, Marta starts working full-time. She reports her new income, and the Department of Human Services reviews it and determines she's not eligible for any Medicaid category. So she'll receive a notice terminating her Medicaid in July, which is before her normal renewal date. But because she is in an active category where she's not COVID maintained, the county assistants can act on that change in circumstances, just as they would have before the public health emergency. So when we talk about changes in circumstances, it also raises questions about overpayment. A Medicaid overpayment occurs when someone receives Medicaid when they're not eligible. And they're not supposed to be overpayments if the county assistance office made the error finding someone eligible when they weren't, just as a flag. So we have questions about overpayments and unwinding, and we're still working on getting answers. So this is what we know so far. There are no overpayments for Medicaid received during the continuous coverage period, which makes sense, right? So from March 18th, 2020 to March 31st, 2023, the state was required to keep people on Medicaid, even if they were no longer eligible. So if the state were to say, now you have to pay that money back, that would basically be saying we're retroactively determining you to be ineligible. We've decided to go back and take away your eligibility. They can't do that. The other thing that we say we think should not happen, and we're trying to get full confirmation on this, is that overpayments shouldn't be put on people in the COVID population for Medicaid they receive from April 1st, 2023 to their full renewal date. As I said earlier, the state's not supposed to be acting on changes in circumstances until they do the full renewal. So if there were any kind of overpayment, that would be basically going back and acting on a change in circumstance before the full renewal is due. We have other questions about overpayments that hopefully we can get answered, and look out for our newsletter as we share what we learn. Another area where we get questions is regarding MAUD premiums. So MAUD is medical assistance for workers with disabilities. It's a category of Medicaid for people between 16 and 64 who are working and have a disability. It has higher income limits than most Medicaid categories and a higher resource limit, $10,000. But in exchange for being able to have higher income and higher resources, there is a requirement to pay a monthly premium, which is equivalent to 5% of the person's countable income. So during the public health emergency, when continuous Medicaid coverage was in effect, people were still getting billed for their premiums, but if you didn't pay it, you weren't terminated. And unpaid premiums that were accruing, but we have been informed that those will be, and this is required by the federal government, those unpaid premiums that have accrued during the public health emergency will be forgiven. They'll be wiped out. And our understanding is there'll be a notification to this effect in April to everybody who has unpaid premiums that were accrued during the public health emergency. And these folks also should be considered COVID maintained, people who didn't pay their premiums, and therefore should not be terminated until they have a full Medicaid renewal, right? Because not paying your premium when you're required to means that you were getting Medicaid continuous coverage during the public health emergency, even though you weren't eligible because to be eligible, you had to pay your premium. So these folks, our understanding, will be considered COVID maintained. They need to have a full renewal before termination. Mod premiums will be due again beginning in April. Okay, so I'm gonna go through a little of this and talk about preparing for renewals. People on Medicaid or people you work with, if you're on Medicaid yourself, there's a few things to do to prepare for these upcoming renewals. And I realize it's frustrating to not necessarily know whether you're in the COVID maintained category or not. But I would say, you know, call the county assistance office and ask them, maybe starting in April, like, when's my next renewal? And that hopefully will tell you when you need to look out for renewal paperwork. So you want to report any address changes. If you're not sure if you reported one, contact the customer service centers, the numbers are here, or Compass, or use the mobile app to see what your address is. Or you can do this in person at the CAO and just make sure that information is correct. Also, if you or someone you work with has a language need other than English, make sure that that is indicated on the file, the person's file at the county assistance office. So contact the customer service center about that. If the person gets documents and they're sending them back, write, you know, Spanish, I need Spanish translation on the documents, and ask for interpreters when calling or going to the county assistance office. We also are encouraging people, if they have the technological capacity, to sign up for Compass. Compass is an online application and renewal portal for benefits in Pennsylvania, including Medicaid. And so this has links in these slides to creating a Compass account. You can download an app on your phone if you have a smartphone, and you can sign up for texting. And texting is important because, as I mentioned earlier, when your renewal is coming, you'll start getting a couple texts to remind you and give you the heads up to look out for it. If you think you have eligibility issues right now and want to stay on Medicaid, address them now. So for example, if somebody is in a category of Medicaid where the resource limit is $2,000, but they have $4,000, I would advise looking at ways of spending that $2,000 appropriately so that when the renewal happens, the person will be eligible. And that's just one example. And when you learn about, if you attend our Medicaid eligibility training, you'll learn about the different eligibility requirements. So you can think about what might need to be done to stay under the eligibility limits. And then just pay attention to the Department of Human Service communications. So this is not a time to be throwing out anything from the Department of Human Services. Try to renew timely and respond to requests for information from the county assistance office. Now, if the Medicaid is terminated, and as I said, this is going to happen to a lot of people, some who really aren't eligible and some who are, it's really important to appeal and to do that quickly. If you appeal within 15 days of the date on the notice that you get saying you're terminated, the Medicaid will continue while you're going through the appeal process. Otherwise, you have 30 days total to appeal. You could also and should simultaneously try to resolve the eligibility issue. If it was missing documents, get them to the county assistance office. But we also encourage people to appeal at the same time, because if you just do the reconsideration, you may have a time when you don't have any Medicaid because you didn't appeal within 15 days. This appealing allows you to keep the Medicaid while you resolve the eligibility issues. And then if you don't think you're eligible, or if you're not eligible, explore other health insurance options and programs. I just want to flag, I'm not going to go into these categories, but the county assistance office has to review people for all Medicaid categories that they could be eligible for. And I have some of these on the screen. There's MAGI, which is doesn't have a resource limit, so that's important. There's Healthy Horizons and MAWD, medical assistance for workers with disabilities, and workers with job success, which are for people with disabilities. They all do have resource limits or initial resource limits, but MAWD has a higher income limit than Healthy Horizons. And people who've been on MAWD for a year can get into workers with job success category, which has an even higher income limit. And we have a training on that coming up as well. Kids who have disabilities can be in a category called PH95, where their parents' income and resources won't affect their eligibility. And some people who have needs for assistance with daily living activities can be on waiver. There's also a category for people who are immigrants. So I have a link here to the different income and resource limits for these programs, but I want to flag that depending on the category, the way income is counted might change. So in some categories, they count less than half of work income you get from work. Other categories count all of the income you get from work. So just something to watch out for. Don't assume you're ineligible. Talk to somebody who can talk to you about the eligibility. If somebody is ineligible, though, there are some options. One of the key ones for people who are not on Medicare, so people under 65, or if they're an immigrant who's not eligible for federal Medicaid, is Penny. Penny is Pennsylvania's health insurance marketplace. It's the Affordable Care Act coverage for people in Pennsylvania. And there are very generous right now income-based subsidized premiums. So you can have low premiums. Sometimes people have no premiums. Cost sharing like copays and deductibles are lower for some people. And most people, except for people on Medicare, if they're determined ineligible for Medicaid because of a substantive reason, income is too high, for example, they're automatically sent to Penny. So that's good. If somebody is sent to Penny, Penny will then try to set up an account based on the information they get from the Department of Human Services, and then send a notice to the person to claim their account and enroll in insurance. There are some people, though, if you were procedurally terminated from Medicaid, but let's say you know you're over the income limit, you didn't bother sending in your Medicaid renewal, you can still apply to Penny separately. You're not going to be sent over to Penny automatically, but you can still apply separately. And there are some important special enrollment periods. These are time periods when people can enroll in Penny. Most health insurance, except for Medicaid, you have to enroll at certain times of the year. But if you lose Medicaid during the public health emergency unwinding, you can enroll in Penny within 120 days of losing Medicaid, and actually get retroactive Medicaid if you enroll within 60 days. And it's based on the date you lose your managed care coverage with Medicaid. And then there are other ongoing enrollment periods for people who are lower income. PA-Medi is another resource people should be aware of for anybody who you think should be on Medicare or is on Medicare. PA-Medi is Pennsylvania Medicare Education and Decision Insight. It's run by the area agencies on aging in each county, and they provide Medicare counseling. So we urge you to refer people who are who are ineligible for Medicaid. You've checked other categories, they're not eligible in any other categories. We urge you to go to PA-Medi and they can counsel them on whether they should do a different type of Medicare plan that might control their costs or make their costs more predictable. Or if they are not on Medicare but should be, there's a special enrollment period right now when you lose Medicaid to join Medicare. So this is a very important resource for people who are on or should be on Medicare. And then we also have CHIP, the Children's Health Insurance Program for children under 19. This offers free or subsidized insurance. Now, starting April 11th, and I'm hoping this will capture kids who are going through unwinding, starting April 11th, the County Assistance Office should be reviewing for CHIP eligibility as well. So the hope is that it'll be a seamless process for kids whose income is too high for Medicaid to go to CHIP. But if you have a child, I'm just going to flag something, with a disability who you think wouldn't be well served by CHIP, consider that PH 95 category I mentioned earlier. And then finally, there are some people who may no longer be eligible for the waiver, and they can sometimes get Medicaid through another category and still get the waiver, like MAUD. But there are also pooled income spend down trusts, which is a Medicaid planning tool for excess income going into a trust to keep the waiver. There's also a program for people under 60. It's not Medicaid, but it is a state program for people who don't meet the financial requirements for a waiver and are able to self-direct their care. And then for seniors, there's something called options, which is not very expansive, unfortunately, but it does provide some limited in-home assistance. I'm going to take questions. I'm going to keep the upcoming webinars in this series slide up, but I think we have about 10 minutes for questions. And I see that there are a lot.
Okay, thanks, Amy. The first question has to do with the CAR decision. Will all dual eligibles who lost their Medicaid coverage during the PHE get reinstated and backdated?
That is what we have asked for and what we understand Pennsylvania Department of Human Services to be working towards. But we will be providing updates in our newsletter on that. That is what is required by the injunction.
Are there concerns about staffing at the state to process the influx of redetermination documents? What will this look like if we encounter a backlog in redetermination reviews?
Well, yes, we have concerns about staffing, about whether there's enough staff, whether there's enough staff and whether the staff will be able to handle the onslaught. And I think, there's going to be reporting requirements on this churn on people who lose eligibility for procedural reasons, which will be telling as to whether there is a backlog and what's happening. I don't have a good answer. I'm not going to be able to reassure the person asking this question. This is what we are probably most concerned about, is the impact of the influx of renewals. And then if people are terminated for procedural reasons, like not because they're ineligible, because they didn't finish a renewal, and then they come back in, that's going to increase the work. So we are worried about that snowball effect and are keeping a very close eye on it and going to be looking at data. We hope, yes, I guess all I can say is that is something we're also concerned about.
Okay. I'm certain people, let me rephrase it. Will people who paid MAUD premiums during the pandemic be reimbursed?
I do not believe they will be.
Okay. All right, and the last question we have for right now is just checking if I understood this correctly. COVID maintained category is only people that were enrolled March 2020. Versus non-COVID maintained means people that signed up after March 2020. Is that correct?
I'm going to rephrase it. So COVID maintained is anybody who since March 18th, 2020 or after was on Medicaid and was kept on Medicaid, even though the state could have terminated them if it weren't for the public health emergency. People who are not COVID maintained are people who have been sending in their renewals and who each time they've sent in a renewal have been determined to still be eligible for Medicaid.
Okay, that's the last question we have. I did want to put a clarification. The date of the Medicaid eligibility training is March 28th. It's not the 18th. So Medicaid eligibility 101 will be on the 28th. And that's my apologies. On the slide, it has the wrong date. So I'll fix that before we circulate them. All right, Amy, thank you. That was all we have from folks.
Thank you very much. Let me, we do have a helpline and an email for technical assistance at the Pennsylvania Health Law Project. And when you get the slides, if you have other questions that occur to you, or if you want to run scenarios by us, my email is earlier in the slides, but it is A. Lowenstein, ALOWENSTEIN @phlp.org. Thank you, everybody. Enjoy your Tuesday.